to Health System CIO's interview with Raymond Lowe, SVP and CIO at AltaMed Health Services. I'm Anthony Guerra, founder and editor-in-chief. Ray, thanks for joining me today.
Anthony, thank you for inviting me onto the show. I'm looking forward to this conversation.
All right, me too. Very good. All right, Ray, you want to start off by telling me a little bit about your organization and your role?
Sure. So I'm the Senior Vice President and Chief Information Officer at AltaMed. I've been it for almost 8 years. So AltaMed's a kind of affiliation of companies. At our core, we're community health centers, or an FQHC. We serve over 500,000 lives, primarily Latino, multi-ethnic, non-English speaking, here in Los Angeles and Orange County. Our other programs, we have the second largest PACE program, which is programs for all-inclusive care of the elderly. That's a Medi type program. And then we also, in our for-profit sector, have a restricted Knox-Keene, the Medicaid space, called AltaMed Health Network, as well as a managed services organization called Altura. All said and told, we're about 6,800 employees. Revenue across affiliates is about 2.7 billion. So we're a
Hmm.
pretty nice sized company in terms of what we do and how we serve different parts of the community.
So this will inform, I think, quite a bit of our conversation, but would you describe it as what they call a challenging payer mix, meaning you're not awash in funds to go have fun and try different great things. You have margins that are tight and you have to run a lean shop. Is that accurate?
Yeah, that's totally accurate if you think about it, because we primarily are Medicaid. We have a slice of a Medicare business as well. That program is called Viva Gold, but Medicaid, is not a rich payer in terms of how we do things. It's interesting when I was meeting with my CEO, and I'm also doing budget planning, making sure I don't have too large of a haircut or challenges administratively. I actually ran our spend versus the overall revenue of the organization. And we came in around 2.8%, which is
Okay.
very skinny, right? When you're running an Epic shop, Workday shop, et cetera, on there. And the benchmark could be more around 3.5 to 4 based on the organization that you're in.
Yeah. So you're running it lean.
Very efficiently, right?
Yes, we like that.
Very
Very
efficiently, right?
efficiently.
Yeah,
Yes.
very
So that's
efficiently.
again, that's going to inform a lot of what we talk about. And
Okay.
you're not the only one out there, I'm sure, that's running things lean, and that's generally what we hear. Tight margins, sort of no matter where you are. But I guess
Right.
some of the larger academic medical centers maybe have a little bit more play money, but they probably wouldn't call it that. What do you think about that?
Well, I think grant funding is a wonderful thing. I mean, we do have some grant funding with the big beautiful bill. I think for everybody, that's kind of a question mark. What's happening? We have
Uh,
an Institute for Health Equity, which really looks like what's happening in the community. How are we providing those services? So we do some really good social determinants of health type of analysis, outreach to kind of programs as well. But to my academic brethren, I mean, we look at them, they do phenomenal work, right? We learn from them, right? They
mhm,
can plow the path
right.
for us, right? We're very nimble and agile here at AltaMed. So I think it's a good partnership, seeing what are they doing, where are they going, how can I leverage what they're doing, to accelerate our mission, serving the poor and vulnerable.
All right, very good. Let's go a little open-ended here. Just tell me sort of what's on your mind, or what are your main projects? What are the main things you're trying to accomplish? Trends you're watching, wherever you want to jump in, and we'll go from there.
Oh yeah, sure. Well, with the new big beautiful bill, right? I think healthcare in general is reassessing where are we, what are we doing, and how are we going to be moving ahead. With the passage, and in July, and particularly tied to Medicaid. So we're in California, and in 2024, California had approved Medicaid for all, independent of documentation status. So Ultimate had quite a bit of growth in that time period, just because you don't have to prove that you're a U.S. citizen.
Hmm.
With the new legislation that's being passed, right, with Medicaid being for citizens and then work requirements in terms of what's happening. So we're assessing what and how does that impact us. Obviously, it will affect us in a negative manner, right, in terms of our membership and the folks we're serving. But as an FQHC and community health centers, we are chartered to serve everybody and anybody independent of their ability to pay. So, we're figuring what does that mean? I think we have over 90,000 lives that we provide that level of care to. So HRSA oversees these organizations. There are grants that go with it as well to help us provide that care. But it's really how do you provide that health equity, provide that access to there. So that's kind of number one. So I think we're doing some retooling. 2027 from the Big Beautiful Bill is when the reimbursement really drops. So you have membership challenges now. You have reimbursement drops happening in 2027. The way that things will be paid, more from managed care rates is what we're reading. So that also kind of affects how we view the payer mix, how we see revenue coming in. So we have to assess that, but we are fully committed, right, to meeting our patients where they're at. As a CIO, it's really about the selection is if it's not providing more revenue or increasing operational efficiency, it's not really hitting my radar screen. So fortunately, we've had some really good years of being able to do a lot of innovative stuff. We brought ambient clinical voice in this year with Novella. Our doctors love it. We're seeing productivity. We're an Epic shop. We're a Workday shop. We're 10 gold stars at Epic. We're going into Epic UGM on August 18th. We're fortunately going to be 10 gold stars again. So that's 2 years back to back, which makes me really proud of the team's delivery organization. And we also came in 8 on overall utilization. Epic has a new way of measuring it. So that's great from a clinical delivery perspective. And then when I look at what's happening in my team with AI, it's like, where are we and how are we properly lifting the digital workforce? Right? Not just like assistant AI, we kind of do a query search and pick your favorite platform, but really, where is the ML, large language models coming in? How are we leveraging them? Right? How are we validating them more importantly? So I'm really pushing my team for that level of automation from contact center through data center, through clinical informatics, from other areas. So we have an overall plan to really support the technology enablement in the organization.
All right, very good. So, challenging financial times, the revenue may be going down, but you don't want to not care for the people that you've said you're going to care for. So you see sort of a crunch there, right? We're going to want to keep caring for these
Absolutely.
folks, but we're going to have less money. So that sounds like it's an unresolved issue, but you've got your 2% of the overall number. You don't want your 2% to go down. I mean, the overall number goes down, your dollar amount goes down even if you stay at 2%, 2.8%. So that 2.8% piece could be smaller than it was, and you're already lean.
Right.
So that's of concern to you. And that's why you said I've got to focus on things that either increase revenue or increase efficiency. There's got to be a pretty hard ROI, which takes me to, you talked about the ambient listening. It's a definite ROI, but it's a softer ROI. It's makes clinicians happier, and that's an ROI, reduces burnout. We know replacing clinicians is very expensive. Are you good there, or do you like in terms of the ROI with that, or is even that a difficult sell sometimes when money's really tight?
Yeah, I think well, it's a great example of really how AI is working, right? When it's capturing the patient interaction with the doctor and it's putting into the subjective part of the note and assisting the doc right by capturing the conversation. So I think from a physician bonding perspective, it's absolutely fabulous. From a productivity perspective, our preliminary results, again, we went live in April, May. We thought we have about 400 providers here at AltaMed. We thought, okay, maybe we'll get to 180,
Mhm.
folks on there. We have like 280 folks asking to use it. So we're doing utilization statistics on them as well. So we have seen about a 20-minute improvement, right, for overall doctor productivity, which takes away pajama time and things and lets them get home for dinner. And from an efficiency perspective, and the way that we're actually measuring the ROI efficacies or doing the reports, leveraging signal data, leveraging abridged data information, while seeing how much time, how effective they are in there. And then the other part is working with my clinical informatics physician teams is who do we need to target and help, right? How do we
Yeah.
maximize the utilization of the tool? And then we put our Epic training teams out there as they're going through the different facilities to reinforce the training, the teachings, all provider meetings, again, reinforcing the training, the teaching, et cetera. So it really becomes more muscle memory. So that's kind of how we're approaching it. So we're very pleased with it. I think there's more when the Dan part comes in where you can do an order entry. So we're all very excited about when that'll happen. That'll take more hands off the keyboard and the docs can do that. But I think that'll kind of happen in the next, 6 to 8 months, which is again more productivity. So when you look at the baseline enabling technology of what do you need to do to leverage the futures, I think that's how people need to think.
All right, very good. You mentioned it sounded like a dynamic where you have tasked your team with leveraging AI and LLMs in their workflows. They're the ones that know the workflows. The operational people, the users, the clinicians know the workflows. Your team, should know the workflows well, obviously not as well as the users. But I've always, I've been saying from the beginning that there has to be that education of your team and the users of what these things can do, because they're the ones that know the workflows and know where it can best be applied. But you want to drive that. You don't want to just be casual about it. As you said, I think you want them accountable. Like, I want you to show me things. I want you to show me use cases. I want things to happen here. I
Correct.
know this stuff can be very powerful. So your mandate is to inject this stuff like rocket fuel into our workflows where it makes sense. Is that kind of the dynamic?
Yeah, I don't know if I want to, we could use a Formula One, analogy, and I don't not really quite push a DRS accelerator on some of these things. Um, on the digital workforce, we have to be really purposeful, right, in terms of what we're doing and what are the business cases. So I'm the co-chair of our AI executive steering committee with legal counsel in terms of what's happening. And so we have policies and procedures in place because if you let AI go unfettered without oversight, review, and approval, bad things can happen. The other thing that we are doing, again, for safeguarding before we go out to turn things on is we did some sweeping, right, of all internet access, right? So who is seeing what? We found people there are about 1,000 different type of AI related type areas that could be accessed or people may have touched it. So we locked down a lot of those areas, again, to say what was not appropriate for business. I'll say the other safeguard we put into place is I look at my academic brethren that have the research and the ability to do their own GPT functions out there, but as the CIO, I'm working with Dr. Eric Lee, our CMIO, is like, how do we create the same kind of environment? So we're leveraging our own type of clinical GPT so that, again, it's not shared out into the network. But when it comes like from the technical perspective on there, and I look from a cybersecurity perspective, Cisco House here, what the XDR can contain, identify the threat, provide the recommendation, what needs to be corrected, and then actually do it. Whereas before the process would be something's identified, what do you want to do with it, right? So that's a huge efficiency. And how do you train up your team, right? So they know what to do because the game is changed from the engineers and administrators because now you're more designing, right? How the AI is going to work. You're going to let the AI do and validate and testing and making sure that it's correct in there before we execute. So didn't quite answer your question correctly, but those are kind of my directives of where and how we're moving through it. Again, there needs to be a business case for us to do anything, right? We don't want to do technology for technology's sake. We don't have that ability to do that level of work, from an academic research area. But we don't lose innovation either because execution is innovation and finding a more efficient way of doing it, just pays that in space. And that's up to the optimization areas across the board.
You used the term the game has changed. Can you just tell me a little bit, go into that a little bit more, what you mean by that?
Yeah, so with the advent of AI, we just go back, 2 years, and we're kind of looking at what is this AI thing, what is happening. I think in 2024, everybody knows Dr. C.T. Lin at Chicago, and he was a beautiful ukulele. He had this great song he did at some conference about AI. Didn't know you. If you don't know, look it up on YouTube. It's absolutely fabulous. And then like now we're looking at where and how are we adopting it. And some folks are kind of still sitting out. But when I look at the skill sets of what can be done, it's driving more to from an operational perspective, self-service, right? It needs to be self-service. It needs to be self-administered in terms of what's happening. If you look at it from a patient engagement perspective, how we're doing the omni-channel engagement, how are you engaging your patient in a culturally appropriately perspective? And for us, that means talking to them in the right language. So you're trying to get an appointment scheduled, do that through your IVR, goes back into your Epic, finds out your open slots, offers a slot, for something, or what's happening with my pharmacy refill, what's happening with these type of things. Those are agentic AI because AI is talking, to AI. So that's what we're working through. It's
Hmm.
continue on our digital journey. But even from like a clinical perspective, and if we look at Medicare and we look at hierarchical coding, HCC rates, which affect RAF scores, which affects your Medicare reimbursements, as well as how we're using these large language models to assist the provider with a proper CPT code, right, at the point of care, and then also validating when the coders and billers are doing it that they're actually billing it correctly. So we have those type of things, in place as well.
Right. So that's it. You mentioned we want to find the business cases, the areas of workflow that can be aided with these things, and then
Right.
apply it in a structured way, and then maybe pilot and then roll things out. You know.
Absolutely. Yeah. And I think it's really important. I'm glad you said the word pilot is, it's a great, it's fun. AI is a new frontier, and I'll say it is fun. And we have to have the courage and the ability to pilot. And I'll say what we also have to have is the ability to say, stop it.
Yeah.
Right. So I've launched quite a few initiatives, really in the data analytics area when I was trying to do risk stratification models, leveraging a couple of different systems. And letting them run kind of head to head, and the team's going, well, this is great work, right? This is what we're seeing. This is how the resource utilization band, rub scores are saying this, or saying that. We're showing it here, we're showing it there. I kind of go, so what does it mean at the end of the day? How are they leveraging it? And if A is better than B, right? I said, well, we should use A, but B's so great. I said, yeah, we need to pick one. We
Mm.
don't need to pick two, right? And I tell the team, I go, it's great to innovate, right? We want to think hard. We want to think out of the box, right? I look at AltaMed, and what makes me so proud, it's kind of like the whole Rumpelstiltskin, because we're community health centers, right? And we are recognized as one of the best health systems in the country, just from quality and some of the awards we've run. So it's kind of like Rumpelstiltskins, kind of spinning straw into gold in there. Now, granted, we have great systems that we can build out of. But as I push the team saying, let's do the analysis, let's figure it out, right? And I said, we got to stop. And they get a little upset. They do. And I said, understand, this is innovation. This is innovation on the edge, right? And we have to evaluate where we are, because you can keep doing it, then it turns into a science project and nobody uses it. So again, I kind of tie it back to what is the outcome? What is the deliverable we're trying to achieve, so we can get, to your point, to the rocket fuel of speed accelerate where we need to go to.
Yeah, and I guess you can see how people can get off the rails in terms
Right.
of putting work into things and doing things that may be cool, but either aren't in the workflow. Ultimately, they're not going to get used for some reason. They kind of missed the mark. They didn't solve the actual problem. They're outside of the workflow, or you didn't do phase two properly, which is the training and education that you mentioned. So we had this
Right.
great thing, and if a tree falls in the forest and nobody hears it, doesn't matter, or did it even fall, whatever the expression is. So there's I guess there's a lot of points along the road of innovation that you can go off the rails. And you're
Yeah,
talking
absolutely.
about
Yeah,
reining things in, making tough decisions about we're not going to do A and B, we're going to do one. So it's you have to have an eye to those danger points, right?
right. Yeah, and it's uncomfortable, but I think as a leader, you need to give people space to grow, right? And it's okay to make them uncomfortable. Again, I'm talking to physician clinical informaticists in here, and I kind of use that risk stratification score, on there. And one we're looking at an Epic model, the other one was looking at a Hopkins ACG model on there, and the doc goes, "Well, they're not related." I said, "Well, they are related." And I just hate to use such a simplistic perspective, but I challenge them to think out of the box, right? A watermelon and a strawberry are related. They're both fruits, right? They're out of the same species, phylum area. They both have seeds. They both have skins. They both, and I go, you can find, if you think about it, take a step back, think about it, what you can draw similarities to, even when things are unrelated. And if your thinking makes sense, right? This is kind of a fun part of breakthrough thinking. You can kind of come up with a different perspective, right? And I said, okay, yeah, we were able to normalize it. And then my next question is, what's your confidence factor, right? You're smart people, you're highly educated. What's your confidence factor, right? So then we have these kind of conversations to determine, right, the feasibility. Does it make sense? Does it not make sense? And then we kind of move ahead. So
Yeah, that's an interesting dynamic you just described. That interaction you had with the physician, the discussion, a bit of pushing back. And it makes me think that in order to do that, that's an important dynamic. And in order to do that, you have to have deep knowledge, you have to have confidence, you have to have experience to be willing to push back, and and in doing so, you probably earn their respect, right? So that's a very important dynamic to me between these high-powered users and IT executives, right? Talk to me more about that dynamic. It's so important to the success of people in your position that you get that right. These people are brilliant, they're powerful, they could probably have you fired if they want a lot of times for some cases, right? I mean, these high-powered
right,
surgeons and these academic medical centers
absolutely.
and so you gotta manage that power dynamic. And I'd like to hear your more thoughts on that.
Oh, absolutely. Yeah. I mean, it's an interesting dance that we all play. Independent of the size of your organization, there are going to be some strong voices. But our job as enablers, technologists, innovators, is if there's a specific problem that you're trying to fix, then we need to provide options. And option one could be your current state, right? Option two is, it's either of these two, and these will be the outcomes, and how are you going to measure it? Because I really push hard. What is that KPI? What is that measurement of what we're trying to achieve? And how is that going to be measured? And you put it on the table. And then if they ask me my opinion, do I like A, B, or C? Then I'll give a point of view. But I think we come in and present fact-based conversations with specific options,
Mm.
deliverables, and measurable results. And it's fact-based, right? And it's that collaboration that has people think through and gets them online. And it may take some time to let it percolate, a bit. But that's why I found is the most effective way to manage it.
Yeah, and I think use the term options. I'm a big history buff, so I read a lot of history, a lot of politics and leaders and all this kind of thing. And a lot of leaders want options from those
Right,
who are supposed to assist them and
right,
service them, so to speak. Secretaries of state, secretaries of defense. The president wants options, right?
right.
Here's my policy. Here's generally what I'm thinking. Give me options, and that's how you framed it up. Options.
It's options,
It's
right?
interesting. Just any more on that?
Well, if you think about it, and it works well. I think option one is current state. Well, that's kind of a no. If you want to say, well, no, because option one is your current state, right? Option two or three are different ways that we'd approach it. And, right, there are cost dynamics, implication, people, workforce changes that go with it. So the options should include what does that look like? And I guess, the danger point for any delivery executive is, what is your timeline? How are you going to do it? And there, you need to have good forecasting abilities, and you also need to have good financial acumen, right?
Yeah.
So when people launch onto, capital initiatives, $5 million, $20 million, $100 million capital initiative, there's an OpEx tail. We kind of started off the discussion talking about money, right? Well, whoops, there it is. Hey, why do you have another $2 million of this or that, or 1.8 of that? I said, well, remember we put in this pharmacy system, we put in this radiology system, and there, well, yeah, we spent $10 million on it. I go, yeah, well, remember the operating cost side of that is, it's like 1.8 million, plus I need 3 more people. Well, we didn't talk about that. So when you're playing out the options, right, depending upon the size, right, you need to be super clear what are the costs of support so that CFO is not surprised, CEO is not surprised, clinical leader is not surprised. And I think it's totally appropriate to say, and this is what I need from you in order to make this happen. Right. So and they may not like the conversation, but you've informed them, right? And our
Yeah.
job is to inform them. We come together to make a decision, right? And we go ahead. And I think it's also really important for CIOs to be even more provocative in terms of giving back scorecards, right? People go, I don't want to see it, or it's going to come from the DNA team, or so on and so forth. And I'll say, if this initiative is really important to you, well, these are the specific key metrics that you need to see, right? And we give them back, and I show them to them. I mean, I've taken the position, I do a monthly IT operational report, which captures all of our capital initiatives, our operational numbers, our metrics. I publish it quarterly to the executive team as well. Because what are you guys doing? I said, it's important to be harvesting the good work you're doing, right? Because you never know what says, hey, what have you done for me lately? And I said, well,
Right.
ironically, I've been sharing this with you all along. I said, oh yeah, I remember that. So again, just some of my tactics that I approach and
I
use.
love it. I mean, that's all brilliant stuff, and that's all, like, really good advice for anyone who's not doing it, the transparency, where's that 2 point what's that 2.8%
Yeah,
getting us? Well, look at the report. Here's what it's getting us.
right,
Um, you talked about you talked about the importance of financial acumen, which is huge. And it's such an interesting position because you need so many skill sets to be effective that it impresses me. And a couple of them are very distinct. So there's the deep IT knowledge, and then there's cyber. Now you can have of course, you're probably going to have a cybersecurity executive, maybe not a CISO, depending on your size. But
right,
then the financial acumen is a whole nother piece of it that you would have to attain at some point. There's not a lot of
correct.
CPAs that decide to become CIOs. It's IT people that become CIOs, but then you gotta grab all this other knowledge in order to be effective. When did you realize, or did you have to go acquire more financial knowledge? Did you have to say, "I need to really get sharp here if I'm gonna attain the positions I want, so I wanna do X, Y, and Z," in order to really be able to speak to CFOs. Anything like
Yeah. Yeah, I'll be happy to share that story. So part of my journey, again, I've been here 8 years. For here, I was at Dignity Health for 8 years, and Providence, 3, Kaiser for 10, right? So I've been around the block with a lot of all the big systems in
right,
terms of, but it really was when I was at Dignity Health, and one part of my career, I ran the $2 billion Cerner initiative. So I negotiated all the major contracts, Cerner. Then I moved into infrastructure, and I negotiated Cisco, AT&T, board agreements, system level agreements. And then we had this pro forma that we were doing, and it was actually to upgrade a number of remediation hospitals. And some of these are really old, right? And so we kind of had a plug number in there, and it ran the whole pro forma, right? And it was like an $86 million pro forma. And I had to go to the system CFO, and we had this conversation, and it's like open up the entire spreadsheet, right? And he kind of goes, "Hey, what's happening, at this hospital up in Reading, and why is this cost there? And how did you make that adjustment, right? And how did you validate it, right? And depending on how you answer it, really is important. So you explain the approach, and so the biggest win you can get as a CIO from a CFO is for him to say or her to say, your approach is reasonable,
Yeah.
right? And so when he said your approach is reasonable, I was like, okay, we pass
Yeah.
because he agreed with what we said. He may
Right.
not like the number, but
Right.
he agreed with what we said. And I think the other really important learning I had in that period is we way underscoped what the cost and was going to be to remediate these hospitals. And then and I learned from that CFO, he goes, when we have initiatives like this, going back to pilot, we need a pilot to validate before we go to scale. And we
Mhm.
have to have the courage to say, you know what? I need, $2 million to pilot this. This is what we're going to do. There's going to be the outcomes on here before we make a $20 million investment or
Right.
a, $80 million investment. So we actually, have that confidence in what we're doing. Oftentimes
Right.
they give me the ball, right? Give me my $50 million initiative. Let me just run it. And there's things the things you don't know, and
Right.
depending upon your skill level, something will get you. There's no
Right.
question about it, right? And how do you, manage it, or going back to the board, because we did have to go back for money, was one of the most painful things I ever did in my career.
Yeah.
I'll just tell you,
Yeah.
right? And again, you go back with the options, you handle yourself with dignity and grace, and you do a lot of listening.
But so as you said, the lesson there is to think holistically about the initiative, add in that pilot number if you need to, because going back and asking for it afterwards is not a place you want to be. Put it in the
Correct.
initial upfront, right?
Correct.
Yeah.
Absolutely. Right. Right.
Brilliant. And
So
the transparency is brilliant. Let them know what you're up to, keep them informed, so people know what you're doing. Um, yeah, we're just about out of time, Ray. Let me just ask you a final question and I'll let you go. And this is usually how I frame up the final question is, what's your best piece of advice for someone in your position at a comparably sized institution? So Ray Lowe across the country, same type of organization. Maybe he doesn't have the experience that this Raylo does, little 10, 15 years behind you. What's your best advice to that guy?
I would tell number one, you got to really give yourself pace and grace, because we're all really driven very hard to deliver, and we think we can do it, and we need to know when we need to ask for help.
Yeah,
And there's nothing wrong and there's nothing weak saying I need help. The second way you support that is just having a phenomenal network of peers that you can reach out to. I can reach out across the country. I can reach out to Mike Pfeffer. I can reach out to Aaron Murray. I can reach out to Joel Benko. I can reach out to Chris Carmody, UPMC, or Donna at Utah, and say, hey, I'm trying to think of XYZ, and that synergy, being able to bounce off those ideas in a safe environment, like, it accelerates you so much better, right?
yeah,
And you have to have that confidence of your peer group. Figuring it out by yourself, it's fun, right? But there's so much more you don't know.
right.
So, have that pace, have that grace, have that network, ask the questions, in terms of it. We don't know it all. We all have to help each other.
That's brilliant, Ray. I think that's great advice. It was a wonderful discussion, and I hope I can catch up with you again down the road.
I'm sure I'll see you in a few weeks in Verona.
All right. Have a great day, Ray. Thank you.
Take care. Thank
All
you.
right. Bye bye.